In the world of medical advancements, the role of vitamin D in immune system regulation has remained a topic of growing interest. Recent research suggests that high-dose vitamin D therapy may hold the key to reversing certain autoimmune diseases, challenging conventional medical practices that primarily associate the vitamin with bone health. The idea that vitamin D can influence immune function is not new, but the extent of its impact is still being uncovered through clinical experiences and studies. The medical community has long recognized vitamin D's role in calcium metabolism and bone strength, with deficiencies leading to conditions such as rickets and osteoporosis. However, in recent decades, research has revealed that vitamin D receptors exist in nearly every cell of the human body, including the immune system, the brain, and major organs. This discovery has opened the door to new theories about its potential in disease prevention and treatment, particularly in autoimmune disorders. Autoimmune diseases occur when the body's immune system mistakenly attacks its own tissues, leading to chronic inflammation and organ damage. Conditions such as multiple sclerosis, rheumatoid arthritis, lupus, and type 1 diabetes are among the most well-known. These disorders often have no cure, with conventional treatments focused on suppressing immune responses rather than addressing underlying causes. The prospect of using vitamin D to modulate the immune system instead of merely suppressing it has gained traction among researchers seeking alternative therapies. Studies indicate that individuals with autoimmune diseases frequently exhibit vitamin D deficiencies. This may be due to a combination of genetic factors, lifestyle changes that limit sun exposure, and dietary habits that fail to provide sufficient levels of the vitamin. Genetic polymorphisms affecting vitamin D metabolism can make some individuals more prone to deficiencies, even when their intake appears adequate. These genetic variations may prevent proper absorption or utilization of vitamin D, leading to a reduced ability to regulate immune responses effectively. High-dose vitamin D therapy involves administering significantly greater amounts of the vitamin than typically recommended. The standard daily intake guidelines suggest around 600 to 800 IU. But proponents of this therapy argue that much higher doses, sometimes exceeding 50,000 IU per day, are necessary for individuals with autoimmune diseases. The approach requires careful monitoring to prevent toxicity, particularly hypercalcemia, a condition where excessive calcium accumulates in the bloodstream due to increased absorption facilitated by vitamin D. Research has shown that vitamin D plays a crucial role in promoting immune tolerance, reducing the severity of autoimmune reactions, and preventing excessive inflammation. It has been observed that patients receiving high doses of vitamin D while eliminating dietary sources of calcium can often achieve remission or significant symptom improvement. The connection between vitamin D and immune health is particularly evident in conditions such as multiple sclerosis, where studies have linked higher vitamin D levels with lower disease activity and slower progression. One of the most compelling cases for high-dose vitamin D therapy emerged from observations of patients with multiple sclerosis. A neurologist experimenting with vitamin D supplementation initially prescribed 10,000 IU daily to a Parkinson's patient in an effort to slow neurodegeneration. Unexpectedly, the patient also experienced improvement in vitiligo, an autoimmune skin disorder. This unexpected outcome led to further exploration into the vitamin's potential for modulating immune responses, ultimately paving the way for more aggressive dosing protocols. Further investigation into high-dose therapy revealed that it could be safely administered if calcium intake was carefully controlled. By restricting dairy consumption and ensuring adequate hydration, the risk of calcium-related side effects was minimized. Additionally, magnesium supplementation was found to enhance vitamin D's effectiveness, as magnesium plays a critical role in vitamin D metabolism and calcium regulation. Low magnesium levels have been associated with vitamin D resistance, meaning that some individuals may require both nutrients in higher amounts to achieve optimal therapeutic effects. The growing body of research supporting high-dose vitamin D therapy has faced resistance within conventional medical circles. The prevailing narrative surrounding vitamin D remains focused on bone health, despite mounting evidence of its broader implications for immune function and disease prevention. Medical textbooks and mainstream education largely omit discussions on vitamin D's role in autoimmune regulation, which has limited awareness among physicians and patients alike. In some clinical settings, emergency cases requiring rapid correction of vitamin D levels have been treated with massive single doses, sometimes reaching 600,000 IU. This approach has been used in surgical settings and critical care situations to quickly restore optimal vitamin D status and improve recovery outcomes. The idea that vitamin D deficiency could contribute to immune dysfunction and poor health outcomes has led some practitioners to advocate for its routine use in disease prevention and management. Beyond its applications in autoimmune disease, vitamin D has been linked to neurological health and developmental disorders. Research examining the presence of aluminum in brain tissue has raised concerns about environmental and vaccine-related toxicity. Some studies have found higher levels of aluminum in the brains of individuals with autism, suggesting a potential correlation between environmental exposure and neurodevelopmental disorders. The hypothesis that vitamin D may help mitigate the effects of aluminum toxicity has led to further exploration of detoxification strategies, including the use of silica supplements to facilitate aluminum elimination. The debate over vaccine adjuvants, including aluminum, remains a contentious issue. While vaccines play a critical role in disease prevention, questions have been raised about the long-term effects of certain additives. Some researchers believe that aluminum particles can persist in the body, potentially contributing to immune dysregulation and neurological changes. The rise in autoimmune and neurodevelopmental disorders over recent decades has fueled speculation about the potential links between environmental toxins, immune system dysfunction, and vitamin D deficiency. High-dose vitamin D therapy is not without risks, and critics argue that excessive intake could lead to complications such as kidney damage and cardiovascular issues. However, supporters of the therapy contend that when administered correctly with proper monitoring, the benefits far outweigh the risks. They emphasize that vitamin D toxicity is primarily associated with excessive calcium levels rather than the vitamin itself, and that careful dietary adjustments can mitigate these concerns. The increasing prevalence of autoimmune diseases worldwide has led many patients to seek alternative treatments beyond conventional immunosuppressive drugs. High-dose vitamin D therapy offers a promising avenue for individuals looking to address the root causes of their conditions rather than merely managing symptoms. The potential for vitamin D to regulate immune function, reduce inflammation, and promote neurological health makes it a compelling area for further research. Despite the growing interest in this approach, mainstream adoption remains slow. The pharmaceutical industry's focus on patented medications over natural interventions may contribute to the lack of widespread acceptance. Large-scale clinical trials are needed to establish standardized protocols and gain greater recognition within the medical community. Until then, individuals seeking alternative solutions must rely on emerging research, anecdotal evidence, and specialized practitioners willing to explore unconventional therapies. The implications of high-dose vitamin D therapy extend beyond autoimmune disease. With links to brain health, mood regulation, and even cancer prevention, vitamin D's role in overall well-being may be more profound than previously understood. The challenge lies in shifting medical paradigms to acknowledge and incorporate these findings into standard healthcare practices. As research continues to uncover the full potential of vitamin D, the future of autoimmune disease treatment may change dramatically. The possibility of achieving remission through a simple yet powerful intervention highlights the need for greater awareness and open-minded exploration within the medical field. Whether through high-dose therapy, dietary adjustments, or lifestyle modifications that enhance natural vitamin D synthesis, the impact of this essential nutrient on human health cannot be ignored. The potential of high-dose vitamin D therapy in treating autoimmune diseases is a game-changer, challenging conventional medicine and opening new doors for those seeking alternative solutions. While mainstream medicine has been slow to adopt this approach, the growing body of research and real-world success stories make it clear, vitamin D plays a much bigger role in immune health than previously thought. What do you think? Could high-dose vitamin D be the missing link in autoimmune treatment? Let me know in the comments, and don't forget to like and subscribe for more in-depth health insights. Thanks for watching.